Good evening, dear America House virtual visitors. Welcome to our live session on a very special topic, countering drug abuse and illicit trafficking in Moldova. And our guest speaker today is a Hubert H. Humphrey alumnus, Mr. Eugeniu Cotelea. He is a medical lecturer and addiction psychiatrist at the Republican Narcology Dispensary. He is also a clinical research coordinator at Free Tobacco Harm Reduction Studies. Welcome, Mr. Cotelea. We are very glad to have you here with us today.
Hello to everyone. I'm very happy and glad that I have a chance to present an interesting topic today.
Thank you, Mr. Cotelea. Each year, on June 26th, the United Nations observe the International Day Against Drug Abuse and Illicit Trafficking. And for us, it's an amazing opportunity to address the drug abuse issue and to analyze where our country stands in terms of fighting drug abuse and trafficking, and what it does in order to strengthen action and cooperation in achieving this goal. And Mr. Cotelea will talk today about the national strategy on how to counter drug abuse and maybe our drug abuse reduction programs and other maybe available drug abuse treatments. So, Mr. Cotelea, we are ready to find out more about the statistics of drug abuse in our country and other interesting facts that you prepared for us.
Thank you. Can we put the slides?
Yes, here we are.
Hello again. My name is Eugeniu Cotelea. I'm a medical doctor at the Republican Narcology Dispensary from Moldova, and I will present the Moldova country report regarding drug abuse topic. Republic of Moldova is a small country. The capital city is Chisinau. It have 3.55 million people. The official language is Romania. The level of literacy is 99.36%. The urban population is 42.7%. The rural population is 57.3%. And the GDP per capita is $30,800. Life expectancy and mortality. Just a moment. According to the last data from 2020, the total life expectancy in Moldova is 69.8 years, but among men it's 65.8 years, and among women is 73.9 years. The main causes of death in the Republic of Moldova, according to the last data from 2018, is 58% due to cardiovascular disorders, 16.4% due to different types of cancer, 9.1% due to intestinal disorders, and 6% due to accidents, intoxications, and traumas, and 10.5% due to other causes. But according to some data from World Health Organization, 62.3% of female mortality could be attributed to smoking-related causes. 57.6% of total male mortality could be attributed to very heavy alcohol and tobacco consumption, and 13.7% of female mortality were related to alcohol consumption. Morbidity to addiction disorders, according to the last data from 2018, we have primary diagnosed people with alcoholism are 2.4 thousand people. Among them, men are 86% and women are 40%. The total patients on medical evidence is 46,346 people, and majority of them are from countryside, that consists 29,174 patients, and the minority is from cities, that consist 17,172 patients. And primary diagnosed people with drug abuse are 0.5 thousand people. The total number of drug using people on medical evidence are 12.2 thousand patients, and among them absolute majority are from cities and consist 9,779 patients, and a minority from countryside that are 2,441 patients. Because data on drug use patterns over the years are inconsistent, it is not possible to track drug use trends. The information from various data sources currently existing in Republic of Moldova differs and in many cases is difficult to compare. In figure number 1, we have most injected drugs during the last month according to the EBBS studies from 2020. And we see that in Chisinau, the more used are new psychoactive substances that consist 50.8%. Then we have methamphetamine, we have the heroin, and we have the last, it's poppy. It's extract of opium. And we see that the trends are different in the main cities of our country. Like if in Chisinau we have the majority are using new psychoactive substances. In Belt the trends are different. And in Chisinau and Belt, the most commonly used drugs is new psychoactive substances, 50.8% and 34.6% respectively. But in Tiraspol, it's opium extract called poppy that consists 55.2%, and in Ribnica, the most common drugs is methamphetamine and consists 57.9% of all injected drug used. According to one study from table number 1, it's the general population surveys conducted in Republic of Moldova from 2008 and 2010 to estimate the prevalence of substance use on a basis of representative sample of the population aged between 15 and 64 years old living in the right bank of Dniester River. And from this table, we see that cannabis is the most commonly used illicit drug in Republic of Moldova, and overall there was no statistically significant difference in the prevalence of cannabis use between 2008 and 2010. Both surveys confirm that the prevalence rate of cannabis use are higher in males than in females. The highest prevalence rate of cannabis use were registered among people from the age of 20-24 and 25-29 age groups. However, an increase in the lifetime prevalence rate of cannabis use among the 30-34 age group in 2010 may relate to respondents moving into an older age group between 2008 and 2010. Around 5% of 16 years old respondent has used cannabis or marijuana in the past, and the lifetime prevalence of cannabis use was almost twice as high among males as females, 6% and 3% respectively. In figure number 2, we see that according to the most recent data from the EBBS study on non-injectable drugs, cannabis, marijuana, hashish, and cannabis resin were the most prevalent commonly used in the last month and 6 months in all 4 study locations, with the exception of people injecting drug users from Chisinau, who reported the most frequent use of new psychoactive substances like herbal mixture in the last 6 months. But according to Republican Narcology Dispensary data, the new cases of drug use without addiction were registered in 2019. At the time of registration, the majority were marijuana users that consist 87.5%, administered by smoking in 92.4% cases, and mostly men, 96.6% cases. And we see in figure number 2 in four main cities of our country, the trends from 2012, 2016, and 2020. And we see that consumptions of cannabis is increasing in Chisinau and Tiraspol, and it's decreasing in Belz and Ribnica. In figure number 3, we see the heroin consumptions over the last month in percent according to EBBS study. In 2010, in the general population between 15 and 64 years, the prevalence of opioid use during the life was 0.4%. Lifetime heroin use was reported by 0.1% of respondents. According to the study conducted in the age group between 15 and 24 years, in 2012, the prevalence of opioid use during the life is 0.5%. According to the EBBS study from 2020, there is a decrease of opioid use in all locations under the study compared to the previous years. This may be due to the availability of new psychoactive substances on the market. But according to Republican Narcology Dispensary data from 2019, opioid use was recorded in 85.7% in new cases of addictive use and 5.7% cases without addiction. Injection is the main route of administration of opioids in the new cases of drug use with 82.7% dependency. The discrepancy between administrative data from Republican Narcology Dispensary and the study data from the EBBS study on opioids can be explained by reporting data collection over different periods of time, as well as a significant change in the drug market. Stimulant drugs. In figure number 4, we see that the data from the EBBS study from 2012, 2016, and 2020, and we see that in Chisinau and Tiraspol, the use of stimulant drugs is decreasing, and also in Belz it's a little bit decreasing. Comparing with and in Ribnica, it's increasing. The amphetamine, methamphetamine, ecstasy use, according to the CAP study from 2010, in the general population aged between 16 and 64, the prevalence of amphetamine use during the life is 0.1%, and the prevalence of ecstasy use during life is 0.5%. The prevalence of lifetime amphetamine use, according to the CAP study from 2012, was 0.1%, and the lifetime ecstasy use among young people aged between 15 and 24 years old was 1.2%. According to the SPAD, the prevalence of lifelong ecstasy use among students in 2008 was 1.6%, and in 2011 was 2%, and in 2015 was 1%. The trend is to follow lower values for the use of synthetic drugs in the most location in the EBBS 2020 study outside the city of Ribnica, where this type of drugs is the main and consists 67.6%, and the consumption is higher than 1.7% times compared to the previous round of the study. During 2019, There was a decrease of synthetic drug seizures compared to 2018. Amphetamine consumption at the time of registration in 2019 of new cases identified by Republican Narcology Dispensary is 1.7%. And here we see that in figure number 4 that in Ribneta city that this is the main drug used. This type of drugs is the main used. It's 67.6%. Hallucinogenic drugs. According to the CAP study, among people from 15 to 24 years age old, from 2012, the prevalence of LSD use during the life is 0.1%. Consumption during the last month of hallucinogenic drugs, LSD, hallucinogenic mushrooms, mescaline, reported by the EBBS study in 2020 is 5.5%. LSD is very rare and in both in cases of police-captured drug seizures and in new cases of drug use registered by the health system like Republican Narcology Dispensary. In figure number 5, we see the new psychoactive substance consumption by injection and non-injection use during the last month, according to the EBBS study from 2020 in percent. Consumption of new psychoactive substances with psychoactive properties like SNPP reported in EBBS study 2020 shows that this type of drug is very popular and has higher values than the data reported in the previous round of the EBBS study from 2016, and the percentage depends on area. For example, in Chisinau, non-injectable consumption in the last month was for 2016 35.8% compared to 2020 where it consists 55.4% and predominates in the right bank of Dniester River. In Chisinau in 2020 it was 55.4% and in Tiraspol in 2020 was 16.4% of the cases. The figure number 6 shows the polydrug use over the 6 months according to the EBBS study in 2020. According to the data from the study, the most common mix of substances used of those specified are marijuana and NPS that consist 39.5% and the category of others of the unspecified the value is higher 77.7%. But we see that 11.6% use mixture of opioid and methamphetamine, 2.9% the use of new psychoactive substances and desomorphine, and one of the measures made by our government against drugs are the National Anti-Drug Strategy from 2020 and 2027. That this strategy have the general objective like drug demand reduction, primary prevention of drug use, treatment, rehabilitation, and resocialization of drug users. Second is reducing the conditional drug use risk, like risk education projects and programs through health education, information of drug risk, syringe exchange, substitution treatment, HIV testing, screening for sexually transmitted infections, and psychological counseling. And also reducing the supply of drugs by exercising control over the legal circulation of drugs and combating the illicit drug trafficking and distribution. Also, National Anti-Drug Strategy for 2020-2027 have goals like reducing the drug abuse, addiction, and their social consequences, reducing the availability of drugs on the market, developing of mechanism of complex assistance to drug addicts, implementation of alternative measures to pretrial detention and custodial sentences in cases associated with drug use, promoting the knowledge in the field of drug abuse in order to improve the responses of the institutions and structures of the civil society, and enhancing the cooperation between institutions involved and the non-profit sector. In Moldova, the treatment of drug abuse is free of charge, and the main institution for the drug abuse treatment is a Republican Nargology Dispensary that provide inpatient treatment lasting from 21 to 28 days. Treatment is free of charge, confidential, but patient can be hospitalized without informed consent, except in cases of suicide attempt or in cases where the person represents a public danger. And in last two cases, the police documented request is imperative. For unemployed people without medical insurance, treatment and rehabilitation from substance use disorders are also free of charge in public institutions. But in private medical sector, treatment is offered for a fee. Recovery and rehabilitation for addiction. Recovery services are offered by Rehabilitation and Resocialization Center for the drug addicts and consist in individual and group psychotherapy accorded by different methods, which last a year and is provided by psychotherapeutic teams consisted of doctors, psychologists, social workers, and volunteers that sometimes consist from the volunteers that volunteering from former drug users. These services are this service offers a continuation of care and in some cases pharmacotherapy after the inpatient stage of treatment. All services offered by the center are free of charge and performed on outpatient basis. The non-governmental rehabilitation centers that usually are not from the government or state, these are the private centers, are Medical Center Salvarea Națiunii, the Center Med Zahid, the Therapeutic Christian Community Viața Nouă, Rehabilitation Center Abomed, non-profit organization Inițiativa Pozitivă, and other religious, mostly Christian rehabilitation centers organized by different Christian churches. Drug Abuse Risk Program. An innovative project was implemented in 2018 to distribute materials like syringes and condoms through pharmacy networks, which drug-addicted persons can access via a magnetic card. The non-profit organization Inițiativa Pozitivă launched an effective mechanism that enhances the access to the labor market, integration of the drug users in remission, and also provide health education, information on the risk of drug use, HIV testing, and screening for sexually transmitted infections, psychological counseling, and referral to medical services. The highest level of drug use has necessitated the implementation of risk reduction programs, which has become important links in the prevention of the spread of HIV infection and other harm associated with injectable drugs by providing sterile equipment and etc. In Republic of Moldova, the first drug abuse risk reduction programs started in 1997 and are still active. Drug demand reduction programs. Measures aimed for the drug demand reduction are provided in the law of the Republic of Moldova number 713 from December 6 from 2001, called Regarding Control and Prevention of Alcohol Abuse, Illicit Drug and Other Psychotropic Substances. Their main priority is to decrease in drug use in society, especially among minors, and to help decrease the use of illegal injecting drugs. In order to raise awareness, educate, and prevent drug use by the population, has been launched a series of educational, informational, and collaborative activities with educative purpose on topics related to the prevention of drug using and related subjects. In general and secondary education schools, the prevention of drugs, alcohol, and tobacco use is achieved within the optional subject health education. The implementation of interactive drug prevention programs in technical vocational education has been achieved through the various activities with the compulsory subject civic education and through extracurricular activities with the theme of drugs, alcohol, and tobacco prevention. However, in Republic of Moldova, there is no specialized study and licensing center dedicated exclusively to drug demand reduction. This is the link and sources for the presentation, and thank you.
Thank you very much, Mr. Kotela, for your detailed presentation. It was very interesting to find out these statistics I didn't know about. What's our situation in the country? And I'm curious, what is our situation in comparison to other countries, maybe in Europe or maybe even USA? Are we in a good place? Are we like fighting this issue properly? Or what's the situation of our country?
From my personal opinion, it's the Moldovan medical system and Moldovan prevention and recovery system all need to be enhanced and improved. But I think that it's good that we, like other countries, have free treatment and prevention programs, and we have good standards of treatment. But of course, if it need to be always improved according to the last standards.
So do we have a free treatment in Moldova, or it's not?
Yes. In the institution where I work, the treatment is free, and even for people that are homeless or don't have documents or don't have medical insurance, of course.
And you talked about the national anti-drug strategic plan of our government. So it's been already 2 years since it was approved. What are where do we stand? Are we achieving our goals? Are we moving forward?
I think that it's just a strategic document showing the way where our country should move on that topic. But of course, a lot of work must be done, and I think that a lot of investment should be done in this particular strategy, and I think it should be invested a lot of in professionals and in new institutions. Like probably in our country should exist a specialized institution for drug demand reduction.
Do we have good chances to achieve that goals by 2027? What do you think, our country?
I think we are. I think that Republic of Moldova, it's a small country with small problems. Yes, because it's to look like globally on our country, we are like a small region of Ukraine or even smaller region from USA. From this very big country, they have to change something. It's very challenging. But for us, because we are a small, I don't think that. I think that with some investment, we can achieve a lot of goals and have success regarding this topic.
So we have a lot of hopes for our country.
Definitely, yes.
I hope we will improve our situation in this field. Thank you very much, Mr. Kotela, for this interesting presentation and for presenting us with the statistics of drug abuse and trafficking in our country. I hope our audience enjoyed this live session, and thank you, dear audience, for your interest in this subject and for watching us live. Subscribe to our America House Facebook page if you haven't done it yet, and stay tuned to find out more about our other similar events. Last but not least, I'd like to thank you, Mr. Kotela, for providing us with this interesting, interesting presentation. Thank you, and have a great evening.
Thank you. Goodbye.